Welcome to our special series today. My name is Katie Buckley. This is Dr. Hawkins here. Dr. David Hawkins, would you like to introduce yourself?
I'd love to. I'm Dr. David Hawkins, clinical psychologist, marriage counselor, been in practice for 30 plus years, specializing in narcissistic and emotional abuse.
It's wonderful. And Leigh Ann?
I'm Leigh Ann Fernandez. I'm a licensed clinical mental health counselor in the state of North Carolina, and I've been in practice for 20 years. I've been working in the area of trauma recovery.
And Dr. Hunt?
Hi, I'm Lene Hunt, a former clinical psychologist now practicing as a life and relationship coach with MRC. It feels like I've been doing this all my life, but at this point we're specializing, like the others are, in high conflict marriages and relationships where there's abusiveness and or narcissistic spectrum behaviors.
And finally, Charmin Kimbrough?
Yes, I'm Charmin Kimbrough. I've been working as a relationship coach for about 7 years, dealing with high conflict couples, helping people out of their relational shenanigans and trying to find a life that they love being a part of.
So
Yay.
today we're getting together to talk about the subject of EMDR. So Leigh Ann, who is our specialist in EMDR, what is EMDR? Could you define that for us?
Sure. EMDR is an acronym for Eye Movement Desensitization Reprocessing, and that's a long term to define the type of therapy it is, but it uses eye movements along with the therapies that have been around for quite some time, but also with the eye movements or bilateral stimulation in order to reprocess trauma memories. And so the desensitization piece helps desensitize some of the body sensations and some of the strong emotions that go along with the experience of trauma that sort of get locked in the brain and reactivated by triggers in the present. And then the therapy also reprocesses the ways that you think about yourself, the ways that you think about your environment, in such a way that you can go back into your life after having this type of therapy and feel pretty neutral about the trauma memories.
Okay. And how effective is EMDR in your experience?
So EMDR has been studied for about 30 years. It was developed about 30 years ago by Francine Shapiro, and she began developing a protocol for the therapy. She used it first for PTSD, but it has also been used for many other types of issues such as depression, anxiety, anger, even chronic pain. It was developed 30 years ago. It's been researched for about 30 years, and some of the most important studies that have been done show that 90% of folks that have one trauma experience that they need to work on are better and PTSD symptom-free after 3 to 5 sessions. So it gets really good results for one trauma. And then also there was another study done by Bessel van der Kolk and his associates, and it compared folks with depression experiencing 8 weeks of EMDR and 8 weeks of Prozac. So one group received EMDR, one group received just Prozac. And after that 8 weeks, the folks that received EMDR were doing much better than the ones that just received Prozac. And then they studied the same groups months later, even a year later, and those that received the EMDR were still better all those months later, and the folks that received just Prozac were minimally better. So they still had their symptoms after some time had passed.
You bring up the name Bessel van der Kolk, who is a renowned trauma specialist.
Yes.
And I think there's some folks who might think of EMDR and think it's like, is this hypnotherapy?
Yeah.
Is this hocus pocus? But I mean, the American Psychological Association totally backs EMDR. Bessel van der Kolk totally backs it. It's not hypnotherapy.
No, it's
No,
actually
and I'm not putting down hypnotherapy.
Yeah.
But it's not. There's nothing hocus pocus about it.
Yeah, and a lot of people do associate eye movements with hypnotherapy, and hypnotherapy is also very effective, but it's not something where you're in a trance or you lose consciousness in
Right.
in the same way that you would with, you're not under. You're fully conscious the whole time, collaborating with your EMDR therapist in such a way to move through the therapy and move through the trauma memories in a productive way. And so what happens is you typically start with a target memory, and you also will look at the belief that you believed about yourself at the time, which is normally in the area of like, I'm defective, or I'm responsible for that thing that happened to me, or the world is out of control and I can't control it. So it's usually a belief in that area. And what the therapist does is rate that belief, like how strong does it feel to you?
Yeah.
And then you identify what belief you'd rather think about yourself. So sometimes it's complete opposite, and sometimes it's a little different. Like I would like to feel, if I look back on that situation, that I'm safe and it wasn't my fault. Sometimes it can be as simple as that. And then you also have the person identify the feelings that they felt at the time. And the most important thing about EMDR is the body sensations. So EMDR processes body sensations much differently than talk therapy, and it works deeper in the brain in order to help people rid themselves of PTSD symptoms. So after you kind of map all of that out, you start the session and you watch that number come down. So if the number of distress is 10, you will see that number come down in one session. Oftentimes at the end of that session, that number is completely neutral. The person does not feel any distress when they look back on the memory. And then they go out in their life and, they come back the next week and you ask them again, when you look back on that memory, what do you feel? Oftentimes they still feel nothing. It's just neutral. It feels fine. So it's really unbelievable. I love doing EMDR for that reason, because it's just so powerful.
Well, I was trained in EMDR as well, and I kind of wish I was still doing it, because it's really, really cool and really widely accepted. Tell me if this is a good way to think about this. I think I'm reaching back into my memory here. We were taught that the mind might get into log jams, like a river that's all jammed up.
Yeah.
And so information and new thinking and processing can't really occur, because there's this log jam.
Yeah.
And EMDR breaks up the log jam, so you're thinking clearer, you can remember events, you can talk about them more effectively, you can process information more effectively. Is that a reasonable way, or is that an outdated way of thinking about it?
It's a good analogy, and I've also heard it described like the memories are sort of like this suitcase that you can open up and have an opportunity to reprocess what happened in that file. So it's almost like a file in a way, memories are. So some people with lots of different experiences on a same type of trauma, like let's say abandonment, or let's say someone was assaulted a few different times, it can be sort of in this file of memories with one belief, one body feeling, one emotion, and you sort of open up that to do the exposure work, and it gives the person an opportunity to reprocess it. And it's neat because you're opening that up, not just to open it up and take a look at it and talk about it. You're opening it up, opening up that memory and exposing yourself to it in order to reprocess it, and in order to desensitize those feelings that get you locked into the same stress response over and over again when you get triggered.
I'm really glad that you said that just a second ago, because when you started today, you talked about one memory. But a lot of our clients, it's not one memory, it's a cumulative trauma.
Yeah.
So you're saying that even with cumulative trauma, you can kind of group things by theme and still. So
Absolutely.
Good.
Yeah. So like with someone who has multiple traumas in the same area, let's say they've had, not necessarily even a physical assault of some type, or, their safety was threatened in a physical sort of way. But let's say that a person has experienced abuse over many years, and when they see a certain look on someone's face, or if they hear a certain tone, they may get triggered. They may start to believe, oh, I'm not enough, or I'm defective in some way, and then they start reacting in some sort of script, like the same stress response over and over again, the same behaviors over and over again to deal with that feeling. So EMDR can go in that theme, like you said, and sort of rework that theme and desensitize those body sensations to where the person can go into the same situation almost immediately and respond and react differently because the feelings and the thoughts have changed.
So can I give you an example and you tell me if I'm getting this right?
Yeah.
Okay, so in one of our groups yesterday, we were talking about identifying ways in which people have been harmed, right, by their spouse. And so this woman who is in the process of divorcing her husband and has kind of dipping her toe in dating again, she had gone to the grocery store with this man that she'd begun to date. And very unexpectedly, as he said, yeah, go grab whatever you want, found herself flooded with her experience of her husband, who said he had to give her permission to buy any specific thing. And even if he gave permission when they got home, he'd still really, engage in pretty abusive, controlling, how dare you buy that kind of behavior. And so part of what we were talking about was that was just for her an example of so many ways in which he had tried to control her. It wasn't just about food, obviously. But that was just a really practical, like, uh-oh, I didn't know I was damaged there kind of thing. So you're saying that, like, if she came to work with you, she could bundle her grocery store experience with other things that fall under the control theme?
Yeah. I like that word that you use too, bundle. It's kind of like you bundle certain traumas together when it's complex in nature like that. It doesn't have to be where you process every single time that husband did that in the grocery store and every single time he did that when you got home. And it makes EMDR so very efficient too. Because it, like most of the time, those sort of themes will produce the same body feeling, produce the same feelings. And what you're doing is targeting that deep in the body. So it's not, like when we get in our thoughts, it gets very complex, but when we're doing body feelings, it's very simple. So if you can desensitize that, then the rest follows and fires in such a way that is more productive too.
I'm imagining, Dr. Hunt, when you talk about a client like that, and Leigh Ann, I'm curious, what if the trauma is still going on? Because you talk about one and like it reminds you of another, reminds you of another, reminds you of another, and like,
But especially what you said at the beginning, that if it's still going
what
on.
if it's,
So
because
many of our
many of the folks that find us that work with us, they, they're still in it. So can you help with that?
Some of the folks that I've been working with at Marriage Recovery Center, I think our goal together is for them to be, while they're navigating what they're going to do about the relationship, for them to be less triggered by the same abuse over and over again. So, like if they've gotten to a place where they're numb and shut down about the abuse, and we're trying to get them to a place where they're not so shut down that they're able to use their will and their agency to start making some decisions and start making some changes. So sometimes I'm trying to bring people out of a numbness, and then other times what I'm trying to do is help people not respond the same way. So like, let's say husband, is yelling or manipulating or that sort of thing. If the feeling is normally like an 8 or a 9, let's see if we can get it down to a 3 or a 4, so that they can
say
make
some more about bringing someone out of numbness, because that's, because they've learned to cope that way. And that's how they. My goodness, that seems really scary to me. Like, because they've built some protection, and you're saying to them, no, we're gonna take some of that protection away.
Actually, no.
Does it all work?
One of the things I've been doing recently is helping people build positive feelings. So, like, if you've been in abuse for 10, 15, 20 years, you don't have positive feeling. You either have nothing or negative affect constantly, and then it'll develop into chronic pain and chronic health conditions. Some of the folks that I'm working with, I'm actually helping them with EMDR build their resources. So let's say
love it.
A person experienced being successful at martial arts, for example. I'll have them go back into a memory where they were feeling really good about themselves and really accomplished and felt like they were in the right place at the right time, doing what they were meant to do. And we build that, and that can sort of bring them out of numbness too. where they start to experience positive feelings, and building their resources really can help them feel in their, if they're still in abuse, it can help them feel like, I'm still a person, I'm still good, I'm still enough. And then they start to experiment with, okay, can I do my trauma work? Because oftentimes people aren't ready to do their trauma work yet because of the numbness.
Yeah.
And you have to get into the memories in order to, and feel in order to do the trauma work. But if they can go back and do some positive stuff, it helps build them as a person again.
And you have them build a safe place too, right?
Absolutely. Yeah.
Thinking about they've got a safe place to go to, and
yeah, and what's neat about EMDR is that it's not just going into trauma memories and doing all the nasty, negative, icky stuff. You can also build a relaxation place, a safe place for yourself, to go between therapy, to go at the beginning of therapy. Sometimes we do the safe place at the end of therapy so that they can go back into their life feeling neutral and pretty good and safe.
That would seem really important. I'm thinking about one of the redeemed sessions. It was one that we just had this past week that was about forgiveness.
Oh yeah.
Mm-hmm.
And part of what I say to them is you can't forgive what you haven't admitted to. So if I've not admitted to the pain I feel,
Right.
then I can't forgive them for the injury, right?
Yeah.
But getting them to own the pain they feel, right?
Yeah.
Is me saying, I need you to feel some things that are unpleasant, right? So
Yeah.
if there could be a safe place so they didn't feel overwhelmed by the pain we're about to bring up,
Yeah.
that would be, I think, more comforting to them.
Yeah, and the safe place is really used for pacing, really. Like when I'm doing EMDR with someone, I'm really watching their body language, and if they're looking really, really overwhelmed and like they're checking out or they're really upset, I say to them, do we need to take a break? Do you want to go to the safe place? And oftentimes people are like, no, I got this, They're ready to do it, and then sometimes people do want to take a break, but it helps the therapy feel safe to them, and it gives them a sense of control. Like at the end of the day, EMDR is kind of a procedure versus talk therapy, but there's still like this dance that goes on of, are you ready? Are we going in? Are we taking a break? And the therapist has to be really sensitive and attuned to where the client is with that.
Yeah.
So with EMDR, do you require any specialized equipment, or could you just come to session without anything?
Yeah, so some therapists that do EMDR have this fancy light bar, and they set it up and it goes back and forth and they can control the speed, and I don't know, like it's very helpful, it's very expensive, but it's not really necessary, because the only thing that we're really using with EMDR is either eye movements or taps, and you can do that with a computer, like just look from this side to that side, keep your head straight, of course, but looking from side to side. Or I've had people just tap like this. So there's no special equipment. You're just basically doing bilateral stimulation to your brain by the taps or the eye movements. So certain people, like some people do use specialized equipment, but I find it not to be really necessary.
So this works virtually, it doesn't have to be in person.
Yeah, so you can use virtually the same types of methods that you would use in person. And I would say like the only difference I really find from using it in person versus virtually is that sometimes people start to feel comfortable quicker doing it in person, but it only takes like a session or so for people virtually to start to get in the rhythm of how it works and how it's used. And it's almost like a muscle memory in a way, like it becomes like a familiar, this is how we're doing, this is how we're doing therapy, this is what it feels like, it's not scary, it's not unfamiliar, okay, I know what I'm supposed to be doing now. And at first people usually are like, oh, am I doing this right? Because it's different than normal therapy that they've experienced.
So Dr. Hawkins, you brought on Leigh Ann earlier, a few months ago.
I did.
And when you came to us, you were super excited because she is passionate about EMDR.
Yeah.
And you saw so much potential of the help that she could provide to our clients. Could you talk a little bit about that and how Leigh Ann could help the clientele that you work with, emotional abuse, narcissistic abuse?
Well, my goodness, Katie, I mean, what we all do, high conflict relationships, trauma, narcissistic abuse, emotional abuse, this is really emotion-laden work. It's really, really difficult work. It's really stressful work. And the people that come to work with us, they're in stress. They are carrying stress in their bodies. And so EMDR, this is just such an exciting and perfect fit. It's a perfect fit. And you're going to be a key part of our team and a key part of anybody's recovery process. My goodness, they're going to be able to more effectively work with those of us that do talk counseling. It's going to be a perfect fit. And so what you do will complement what we do will complement you. And so this is a comprehensive package for anybody that wants to come and work with us.
Thank you so much, everyone, for your input and just educating us on what EMDR looks like and what it is. If any of this resonates with you, or if you want to book a session with any of these lovely ladies, please visit our website, marriagerecoverycenter.com, or you could give the client care specialist a call at 206-219-0145. Thank you, everyone.
Thank you.